Good afternoon and welcome to today's broadcast. I'm Chris Prosser, Events Manager at the WBJ, and I'm joined this afternoon by a panel of experts who explore how the pandemic has disproportionately affected working women and how businesses can build a flexible support system along with practical and progressive policies and programs that can help in supporting and retaining women in the workforce. The special broadcast session is brought to you by the support of our series sponsor, Bowditch and Dewey, who have been a great partner for many of these webcasts, and we thank them for their commitment to the community and programs like these. Would also like to give special thanks to our promotional partners from the Marlborough, Metro West, and Worcester Regional Chambers of Commerce. We appreciate their help in getting the word out about today's important discussion. And finally, before I hand things over to our moderator and we jump into the discussion, just a couple of notes for the audience. If you have a question, please type it into the Q&A box. And we'll get to as many as we can possibly. And then if we don't get to any of them, we can always reach out to you post webcast and try to answer some of those questions. Today's webcast is also being recorded and a link to the recording will be sent to everyone after the event. Now I'd like to hand things over to today's moderator, AiVi Nguyen, who is an attorney and partner at Bowditch and Dewey. AiVi, the floor is yours.
Thank you, Chris. So we have a jam-packed 1 hour ahead of us. So I'm going to try and keep my eye on the chat box for questions, but please don't be offended if I don't get to your question. It's not because I'm ignoring you. It's because I think we're probably going to get to it later on in the session anyways. So without further ado, we're all here for the same reason, right? Because we know that whether or not you know the hard numbers, we know that women in the workforce have been, the pandemic has hit them harder than it has hit others. And so the question is, how do we curtail that? How do we fix that? I do want to share some hard numbers with you though, to confirm that what you are seeing is actually true. And these numbers I got from Professor Jean Beaupre from Nichols College, who has collected a lot of stuff on the Shecession. In 2020, 9.8 million people lost jobs. Approximately 4.4 were men and 5.4 were women. Women are experiencing an average of 5 more hours of unpaid work a day. So when I say unpaid work, I mean like childcare, caring for parents, you know, just maintaining the house that before the pandemic was on their plates, but now there's 5 more hours of it. In the summer of 2020, 1 in 4 professional women was considering downshifting or leaving their career. So between the 5.4 million who lost jobs and the ones considering or who actually did downshift and leave their jobs, I think it's fair to say that this past year in the pandemic has seen alarming numbers for women leaving the workforce. And since 1988, 2020 was the lowest participation rate of women in the workforce, and the number is 57%. So it's the lowest it's been since 1988. So the question is, what do we do? I think we've been in survival mode on the individual level and on the corporate level. So we're in the vaccination stage now, but that doesn't mean the pandemic is ending, and we don't know when it'll end. We don't know when we'll stop wearing masks and we can go back to the office fully. So the question is, what can we do? What can companies do to pivot now during the vaccination stage and sort of move forward with their businesses with the eye towards sort of helping to curtail this Shecession? So the point of this seminar is not going to be to talk about the problem. I think we all know the problem. The point is to talk about solutions. And what I do want to note too is the solutions you'll hear aren't women specific, and some of them are, but most of them are not. And it's the same way the pandemic is not the COVID-19 is not a woman specific virus, right? But we know that it has sort of disparately affected women, and the solutions that have worked for companies work for everybody. It just happens to be that these things, I think, address the Shecession more. Okay, so here's how I want to this is just a general overview of what I think the conversation should be today. Now that we know there's a problem, just trust me, there's a problem. I gave you the numbers. The next steps would be figure out what your employees need, figure out how your company can meet those needs, if your company can meet those needs, and figure out how to pivot from like this surviving mode to a thriving mode for the future, right? I'm not going to go through the introductions of the panelists because we all can read. Shelley is with BJ's, Desiree is with UMass Memorial Medical, Katie is with Staples, and Chelsea is undergraduate at Bowditch and Dewey as well. So I'd really like to just jump into the first topic, which is figuring out what your employees need. And I suspect that what we talk about is going to make HR people a little bit anxious, because assessing what your employees need in this circumstance is very counterintuitive to what HR people have been accustomed to, which is not being touchy-feely, not asking personal questions, not prying into the private lives of our employees. So with that, let's ask the panelists, what have you done to take the temperature of employee needs?
So AiVi, I can start. So we kind of approached the pandemic with safety as our top priority, safety of our team members, as well as safety of our customers that we call our members. So really important it was to stay connected with our team members throughout the pandemic, more than we ever had in the past. And to your point, it became much more touchy-feely and more about emotions and how people were feeling about the pandemic than we had probably ever touched on as a larger organization before. So we really wanted to create that two-way communication, especially with our team members who were on the front lines. As BJs, we stayed fully operational the entire time that we were working through this pandemic. So we had people in our clubs, we had people in our distribution centers, and we also had our home office team members. So we were looking at all of those groups holistically, but also individually, because they were all impacted differently throughout the pandemic. So first and foremost, we implemented frequent town halls and field market calls. But most importantly, we reserved a majority of the time on those town halls and market meetings for questions, where our team members could ask any of their questions and receive an answer in real time directly from our leadership team. So this was a little different than what we had ever done in the past. We used to present information, but this was really getting information back from our team members as to how we could help them navigate through the pandemic. We also implemented team member surveys to assess our team members' needs over time, as we knew that their concerns were constantly changing. So what worried our team members at the beginning of the pandemic was very different than what started to worry them throughout the pandemic, as we realized this was not going to be a 2-week pandemic, but it was going to last a lot longer than that. And then lastly, we made sure that our regional support partners out in our field were actually present in our distribution centers and in our clubs so that they could connect directly with our team members on the front lines. So many of our team members don't have access to email. So how do we communicate with them? And a lot of that was the responsibility of our regional support partners, who met them in the DCs and in the clubs to hear their concerns and then really be able to act on those in real time. So those are a couple of the things that we did at BJ's to really create that communication, that two-way communication with our team members.
Great. Anybody else?
I mean, I think, one thing, the pandemic created, right, was this urgency culture for a lot of industries, healthcare especially, right? And I think, part of moving from the survival mode that you mentioned, AiVi, requires that, process by which you stop and assess. And I think Shelley just gave really good examples of, how that can be done. I think there are other, obviously obligations that, can flow from other entities in your workforce, like, having a union, a bargaining representative, and those collective bargaining obligations, which are directly at tension, right, with that need to make a decision really quickly and feel like you have, what you need to do that as an employer and being able to move forward. But, I think a couple of things about that, right, when you're thinking about the union partnerships, and something that UMass ended up, really having to leverage, in so to speak, in terms of moving through the pandemic, is that, you know, a lot of times this is a potential avenue, right, for learning about what's going on with your workforce, right? There's a trust relationship that the staff have with their bargaining unit representative, and, you know, keeping those lines of communication open allows for that flow of communication to come through and to do the problem solving, right, at the table around it. I think the other thing about that, right, is, you know, part of, you know, the collective bargaining process is, you know, both sides are coming with wants and needs. And I think, you know, all of us on this call from the management perspective, you know, are, you know, generally frustrated by that process. But I would say, you know, a lot of our friends on the other side of the bar are also frustrated. So no one ever really walks away happy, right, when you're sitting at the bargaining table. But the point is, right, to establish what are the baselines needed for this relationship and what are the avenues, right, of communication so that we can triage things, right? You know, that's why you have a grievance procedure in your contract, so that you can triage concerns and ultimately resolve them in an organized fashion. And I think, again, taking that time to set that structure in place, you know, we had regular communications with our bargaining units, especially, you know, it was something that we started and ended up having to refine over the course of the pandemic. But it really did help in terms of, again, keeping a pulse on what are the things that are bubbling up that we can either, you know, adjust, resolve, assess in a collaborative fashion. But again, it does require you to butt up against that initial inclination, right, to make the decision, because you know what's best, right, as the employer.
Is it fair to say that it's just the listening that people need? You know, I'm assuming that there were needs that cannot be met. Like, companies are not going to be able to give their employees everything they need to get through their personal like the personal hurdles we have because of the pandemic. But creating a space where someone can say, this is what I need, and this is why I'm not able to, you know, make all these meetings. This is why I'm not able to cover this shift, is better than not having it, even if you don't have the solution, even if you can't give them a thing that will fix the thing that they need. One question though about assessing needs is, like I said, this is just not how HR people are wired. And some people do not have a knack for getting, you know, information from their employees on that personal level. And is there any advice that you can give with respect to sort of training your managers to be able to shift the way they talk to the employees and how they assess and how they gather this information?
Well, I think it kind of goes back to just jumping off what you were just saying, AiVi. I mean, it's about setting the form, right? And I think part of that is knowing what questions to ask and making sure you're asking the right questions to get to these areas. I think everybody knows people don't come to work from the same place, whether that's, you know, because of your race, gender, socioeconomic status, whatever the case may be. And so, again, one of the things we like in HR are consistent practices and policies, right? And, you know, I think some of this requires you to move away from that straight line approach of making sure that the results are all the same, and really making sure that the process, you know, is broad enough and holistic enough that you can ultimately, you know, make sure that people are getting the same response in terms of, you know, they're getting somebody who's asking them questions, listening to their answers, and giving them options and based on what they're saying. And that ultimately, right, means that everybody's not going to get the same result. Everyone's going to get a different solution. But again, I think, you know, part of that is not looking at that inconsistency, right, as a troubling factor, and really looking at it as it is the natural result of what is actually a consistent process, because we've gone through and identified, you know, these areas that we know we need to, you know, make sure are allowed for, right? We're creating the space and allowing for to get that feedback from the colleague.
Yeah, I think I would just add to that, Desiree, that for us, it was so important to get the leaders to understand what was going on at all levels of the organization. And so outside of your specific function, you know, we have hourly folks in warehouses, we have, you know, executives sitting in headquarters, very different groups. And to your point, it's all about listening to what they need, and it's going to be different across. But we relied really heavily on our leaders and, pushed empathy across no matter what the issue was. Remember to be flexible, remember to be thinking, for instance, even though maybe your kids are grown and in college, that 3 levels down from you, you have a single mom who's home with no childcare trying to do their job on the computer. So if they're doing a presentation and there's noise in the background, we've got to be flexible. So for us, especially though, even like out in the warehouses, to get communications out, we created toolkits and tried to bundle, because there was so much going on too in terms of emails. And so really to get our leaders focused on what we felt was most critical. And mind you, so much of it was an assumption. Like we've never been through this before. How do I know what I don't even know what I need, never mind the people that I work with. So, we were always kind of idea sharing with other professionals. We were benchmarking. We were just out on chat boards, doing whatever we could. And I think a lot of our programs, whether it was information bundled about childcare or paid time off or just flexible scheduling, all of that, we got it in the leaders' hands. They found ways in our warehouses, for instance, to put posters up to get the word out, because we couldn't do stand-up meetings, right? So all of these, every time you thought you had this great idea to get information out, you ran into a roadblock. But really, I would say our leaders were so critical to all of that. And without them, we would never have been able to reach the associates. And I think really do a great job by them to support them through all of it. But communication is key, and just identifying the various needs. And I feel like always reminding leadership that your function is very different from the function next to you is helpful in times like this.
Right. And I think it's, I heard this at a presentation that I went to several months ago, but it's about, really focusing on the relationships versus the tasks. So much of HR and what we do is transactional. You get a leave request, we need to fulfill it. How long are you going to be gone? What's the reason? And really this work requires you to dig a little bit deeper. And again, look at what those baseline transactional questions aren't getting at. And I think that's exactly what you're talking about.
Yep, exactly.
Yeah, I think Desiree and Katie, we tried to not to overcomplicate it in a lot of ways, right? Like connect with your team members. AiVi, I think you said it, actively listen to them and try to dig into what they may not be saying to you, right? And we knew that some of their questions were not very complex. One of the ones that came up early in the pandemic was, I have to wear a mask, but every time I wear a mask, my glasses fog up. So what can I do about that, right? So it was giving them a simple solution to a question like that, but then also helping them through the fact that they couldn't see their ailing parents, right? Because they were restricted from going into a nursing home, and how could they try to create that connection in their families, and how could we help them do that? So it was trying to navigate through all of their concerns, not just work related, but very personal as well.
Mm-hmm. Navigating through personal things as a lawyer, that makes me uncomfortable a little, right? So I'm going to look to Chelsea and ask for some helpful advice as to like the parameters that people should be keeping in mind. Because while we do want people to look at their employees holistically, there are still things you cannot and should not be doing, asking, putting into place because they would be illegal. I'm looking to you. I hope you're nodding.
Yes, thanks, AiVi. So I think an important thing for our employers to remember is that if we are asking our employees to shake the tree, so to speak, we need to be prepared to handle what might fall out. And this might include, requests for accommodation, but also complaints of retaliation, discrimination, health and safety violations, any protected complaint. This can naturally happen at any time, but especially if you are, actively having those conversations with employees, which are important, just be prepared. You need to make sure those people having those conversations are prepared to deal with the issues that might be raised. So generally, supervisors are the ones that we traditionally think as interacting with employees in this way. And while we don't have time, unfortunately, to do a whole supervisor training, there are 3 important points that I do emphasize when training supervisors on interacting with employees. So first, I would say that if a supervisor isn't trained to handle all issues that are raised, so if the supervisor doesn't know, how to engage in the interactive process, that's completely fine. That's normal. Generally, that's a human resources function. What the supervisor needs to know very clearly is that they need to issue spot and pass it along to someone who can handle it. The supervisor should know not to wait for buzzwords such as discrimination or retaliation to act, because the employees don't need to use or know legal jargon when filing a protected complaint. So that's the first thing, is the supervisor should know, issue spot, hand it over immediately, get that information to someone who can act. Second, it's really important that supervisors know the consequences of their failure to act. Once a supervisor is aware of a protected complaint or a request of accommodation, that means the company is aware, legally speaking. The company is deemed to be on notice, which means that the company has to act. And if the supervisor fails to pass on this information or responds incorrectly, tries to deal with it themselves and are ill-equipped to do so, the company's failure to act could place not just the company in legal jeopardy, but also the supervisor as well. So that's the second point, is know the consequences. Third, I think that a lot of times when we're having these conversations, supervisors or really whoever is speaking with the employees directly will want to naturally promise confidentiality to get that person to open up. And it's just a natural thing we do in private conversations, but it really is not an appropriate promise for the workplace because it's just not actually how it works. There are no off-the-record conversations, and the employee or supervisor should tell the employee that they're speaking with that confidentiality will be respected as much as possible, but can't be ensured in order to fully address their concern, report, or their request. So those are kind of some legal guards. Again, it's not everything, but just some points to keep in mind when you're preparing your employees to have these conversations. Thanks, AiVi.
Thank you, Chelsea. So sort of moving along to, once you figure out what they need, what's the process for how to deliver it, right? So the way I see it is flexibility is the key word for everybody, but some companies are not in a position to be flexible on certain things. And I suspect that if things are going to be pricey or expensive, a lot of small businesses are unable to come up with the money to be the kind of flexible that an employee may need. And I'm thinking specifically about childcare. And I think that the childcare issue has been the big time suck for women. That has been the thing that has made this Shecession so prevalent, because if kids aren't going to school, someone needs to be watching them. And I think traditionally it has been women that have the heavier burden of maintaining home, even if everybody's working, somehow it is the women. So can we talk a little bit about how your companies address flexibility within the scope of what you could do, and if you couldn't deliver it, what did you do to make the employees understand and hopefully transition to something that could help them?
I'll jump in here, AiVi. I think, every company is different size, what they do, widgets versus services, et cetera. And so you really need to figure out, again, going back to your people, which is really the foundation and the commonality for all of us, what do they need to do their jobs to keep this company going? And at Staples, where we're literally, an office products company, you go through something like this, and it is exactly what is the critical offering that we need to make here. And so for us, it was, how do we give our folks in the buildings, our warehouses, the ability to flex their schedule? We're not going to dock points, for instance. If you're late, we're going to allow you to come in and have a window of time. We're also going to provide things like childcare, maybe not services, but the opportunity to sign up for a sitter city where you can go out on an open market, and we will, as a company, support that service for you. So you can go and log in for free. And then there were just other things about, whether it was from EAP or ways for people to learn to ask for flexibility, right? Self-promotion to some extent, and again, teaching managers. And finally, we created, in some cases, interim policies. So where we couldn't flex the policy to meet the need, we created a supplemental sick time bucket, which for us was a short-term policy. Now that costs money, right? But there are ways that you can accommodate in this environment that don't cost money. Like, for instance, we were forced to furlough people, but we brought them back. We also offered things like voluntary time off, unpaid, but people can collect unemployment. So, these were things that, to your point, impacted women, I believe, more so than men, just because they tend to have more of those childcare responsibilities. And so these programs, I think, were even more valuable. But for sure, we should all acknowledge that, men and women, both parents alike, were all impacted throughout this environment. And hopefully what we were offering from flexibility was really helpful. And I think even when you look at the corporate teams, many of us as managers were saying, I don't care when you work, I just need the work to get done. So if you need to be offline to do remote schooling, go ahead and do that. We'll meet at, certainly for me, my children are older. I was like, let's meet at 5 o'clock, if that works best for you. So just kind of everything from something as small as that to rolling out an additional bucket of sick time, I think certainly helps throughout something like this.
Katie, at BJ's, we did some similar things, I think, to what you all did at Staples, and I think a lot of other employers did them as well. But at our clubs and distribution centers, we changed many of our policies to support and protect those team members because we were fully operational during that time frame. So how do we address the team members' concerns about the virus, but also continue our operations during that same time? So we kind of waived our absentee policy at the beginning of COVID, where no questions asked. If you did not want to work, if you didn't feel comfortable working, you didn't have to work, and we would bring you back to the workforce when and if you were ready to come back. We also provided up to 14 days of kind of mandated quarantine time. So we extended really that sick leave bucket. If someone had been exposed to COVID or had contracted COVID, then they could take additional time off while they were treating. And then we, of course, implemented a lot of mandatory sanitation and safety protocols, such as masks and social distancing and additional cleaning to keep our team members safe in our distribution centers and in our clubs. We also heard from our home office team that working from home kind of blurred the work and home lines. So in response to that, we kind of implemented a couple of different things. First and foremost, we asked everyone to put a moratorium on emailing outside of regular working hours. So try not to email over the weekend. Put a delay
I'm like such a big fan of that.
Yeah. And we all kind of, we had to work through it, right? It wasn't natural. You wanted to just hit send on that email, but I can definitely say that it really helped a lot in terms of making sure that you had your work time and you had your home time, really to allow our team members to disconnect from work. Because when your computer is right there, your workstation's right there, I think people were prone to, check their email at all hours of the day rather than during, those regular working hours. We also created one of our talent leads created what we called virtual hallways, which I thought was it was just great to be able to connect with people. So what we heard from our team was they missed having those conversations as they were walking in the hallways at home office, like someone maybe they hadn't seen before, or maybe just to get a quick answer to a question. And so we created those by Zoom to really simulate that experience for our home office team members. And then I would say the last thing, or one of the other things that we did is we also worked with our team members to adjust their schedules. And we did that both in the clubs where we have our flexible working schedules and shift work, where we could work with our team members so they could continue working, but we could also flex their schedules in order for them to have to, homeschool their children or take care of their elders or whatever else that they may have been working through during the pandemic. I know that one of the women on my team has 2 small children. And my children are older, so I couldn't really connect with what she was going through. But what we decided to do is block off her mornings so that she was able to homeschool her kids, and then she could separate work and home and really be able to focus on her kids in the morning and then work later on. And that was a solution that worked for her. And we did that with a lot of people, right? What was the individual solution that was going to work for each of our team members so that they felt supported, but they could also manage both their home and their work lives?
I think something that Katie had said earlier, and it may be a millennial thing, but millennials have always said, why does it matter if I'm sitting here in front of you for you to know that I'm working, right? Like, why does it, if we shifted to a sort of a task-based, project-based way of looking at productivity, then the stress of being in my chair at 8 a.m. till 6 p.m. suddenly goes away, right? So we'll get to this later, but the hope is that we take these things that we've learned in the pandemic just to say, wow, we trust our employees. They're doing their work. We just, we don't need to see them, and we don't need to know when they're doing it and how they're doing it. But I think that if we're able to pivot this, that it would make the future better for employees, and certainly for female employees.
Yeah, and I think the other thing is, sorry, there's just one other piece I wanted to bring up, AiVi, is there's been a sort of, hey, if you're sick, you still soldier your way into the office, or depending on where you work, right? And it's kind of like, I'm gonna, and you're coughing, and everybody's like, why are you here? And you're kind of, putting the brave face on. I don't think we're going to see that anymore. And I am so happy about that, because every winter it's like clockwork. Everybody gets sick, and, and then over at the daycare, the kids at the daycare are getting sick. Yep. And I think, again, this flexibility is in that way certainly going to have just such a great impact on the health of our employees, right? And their children and their families too. So.
That's a great point.
We hope.
Do you have anything to add to this?
Yeah, I was going. I think the thing is, and as we're kind of talking about, the different structures, I think so much of what it is, right, AiVi, is what you said about being able to pivot, right, from what we're normally used to. I think in the UMass context, it is a 24/7 operation, and I mean that is for a lot of reasons, right? There's no deadline on when you get sick, so obviously but it also left the floor open, right, for different structures to be utilized to allow for the flexibility. And I think, in the past, right, before the pandemic, these structures existed, because in generally, again, having a 24/7 model, you need, again, different models of working arrangements to make sure you have full coverage. But now we're moving, and now we're shifting from this is just the structure to this is actually needed. People need these arrangements to actually get through not only their, at UMass, we're all caregivers, no matter what your job title. And I think, one of my colleagues and I were talking about, this concept that we've, been discussing in HR, is that we're caregiving at work, but then you also have your caregiving responsibilities at home. And that's the second job, right? And trying to ultimately, again, utilize the structures. And Shelley, I think you talked about this, and maybe Katie as well, too, utilizing the structures that we have, right, to where can we, go a little bit further to meet where people are, and kind of, moving away from just, this is just here to, again, this is kind of the model that we need to kind of move through this and get to the new normal. And again, I think in the hospital context, you have, part-time positions, per diem, non-budgeted positions that give people the ability to, step back from, having to do a 32-hour-a-week job because I now need to, either be at home during the day while my, husband, who's also emergency responder, is off, during his day shift. So like making sure we have those rooms. And I think, again, leveraging the partnerships that are there, with your childcare entities. And I think, Shelley, you talked about this or Katie, we talked a lot about different objects. So it's kind of like all, and I think you're right, Shelley, a lot of people faced with these same things. So we're all kind of doing the
Yep.
same things and seeing like, okay, we have this on-site daycare, how can we, expand this out, whether it is creating a backup care option that people who are, my normal daycare is closed and I have no one here to take care of this child, and, making sure that there's some, other resource there. But I think the other thing comes up with it, and I think this is the biggest piece that we're all kind of talking around, is that it is about re-educating kind of everybody around these things. And I think, you know, finding creative ways to get information to people, I think is part of the struggle, because you create these mechanisms to respond. And I think, you know, it in many ways, right, addressing the challenges all the way down to your front line means also being creative in how you get to the communicate, you know, to that front line. I mean, it's not as easy as our administrative corporate employees who just get the email and they're like, oh, daycare, let me go and register for that right now. When you have somebody who's, you know, either doing food services or, you know, retail on the front line, they don't necessarily have their phone or access to a computer to check those things. I think that's the other thing. And, you know, it's always a challenge. And I think that's the other part of being flexible, right? Recognizing where you have to kind of take another step forward and address the gap that may not have been as visible before.
I think this is a good segue into sort of thinking about the future, right? So maybe things were not flexible before because we didn't have to be, but it took a pandemic for us to sort of rebuild, or it took something else destroying for us to now rebuild. And I think that I'm an optimistic person about it. This is our opportunity, right? To recreate our workplaces so that not only are they pandemic proof, but like, so that they are a place where your employees can thrive, and specifically your female employees, right? So the flexibility measures that worked this past year, it would be weird to make them go away. Like, it would be weird, and I just don't think will ever go back to December 2019. We're never going back, right? So we can embrace moving forward and adopting the change that we saw working, you know, this past year. But the question is, how do we do that, right? Like, how do we come out of emergency mode, survival mode, to really rethinking long-term? And this is open to everybody.
Well, I think part of it is, you know, moving away from the idea that we can return back to 2019. I think that's, and whether we really want to. I think if we're all of us on this call are honest with ourselves, you know, the pandemic revealed some nasty realities with, you know, how people experience the world, and, you know, how that comes into work, and how they, and influences how they, you know, interact and experience their work environment. And I think, you know, part of the reckoning that, you know, we're all kind of in is that recognizing that we can't go back to that. We can't go back to, you know, the glaring disparities that, you know, again, this pandemic revealed. But we also just can't just brush over it and act like it doesn't exist. And there are real challenges to moving forward. So I think, you know, part of it is, you know, doing the assessment that we talked about in the beginning, and really looking at those gaps, but also kind of looking at, you know, where your pipelines of success are. And, you know, that's something that we've been talking about a lot at UMass, and we're in the infancy stages, right, of kind of looking at, as far as an equitable initiative, how are we as a workforce, again, kind of, you know, are we really the best place, you know, to give and get care for everyone, including people of Black and Brown and all different demographics, and our caregiver community, and where we're not, you know, how can we, again, leverage where we're doing well in those other areas? And it is about kind of looking at the demographics and the data, and the trends. And it is a lot of finding out what you don't know, right? And how you can find out more. And what we're recognizing is that we can look at these numbers, but we still need to know more. So, you know, figuring out how we can set up the avenues of communication with the communities within our workforce to talk about what are the challenges they are feeling and seeing in terms of their ability to develop and move forward in the organization. And again, taking that data and then assessing and putting it back into the bigger puzzle, and again, trying to figure out what the next step is, part of the work, right? So no one really has that answer. And I think that's what's uncomfortable about it. But I think, you know, it is, being uncomfortable is a big part of moving forward, right? And I think, you know, part of being aware of that and knowing that's there, but also knowing that, you know, there's a pathway forward. It's just going to take a lot of communication, a lot of adjusting, because we may not get it right the first time. We may not get it all the way right. We may need to take another step. But again, making sure that you're kind of lining yourselves up and partnering with throughout your organization at all levels, like we talked about earlier, to, you know, make that change, which is, you know, a lot. It's not,
and it's constant, right? Like the assessment, you're always assessing, right? The problem, the reason we are here, the reason we were where we were in 2019 was because we weren't assessing enough, I think, and we were just living the workplace life that was created, that was fine for everybody, but it turns out that it was harder for certain buckets of people, certain demographics of people. And I think that the way that your organizations had to continuously assess what the needs were in 2020 is maybe the way HR and organizations should be moving forward with assessments of employee needs.
Yeah, I mean, one of the things I think about is just because we're kind of through the initial chaos of it all, and folks hopefully are getting childcare again and all that, but you know, also people now, some folks who are really impacted by it from a childcare standpoint or otherwise are kind of saying like, I just want to have a year of reset. And so when you talk about the pipeline and you talk about women impacted, and you have to, I think, also give thought to like, maybe it's not about the next promotion right now for them. Maybe it's just about a year of like deep breath, healing, and that's okay. That doesn't mean I'm not going to revisit whether so-and-so is ready for a promotion a year from now, but we better start telling people that it's okay to be human for this next year. And that if they don't have at their top of the list what the next rung on the ladder is, that's okay. And so I think from a pipeline standpoint, that's one thing I'm thinking about. And then also from sort of a mentoring standpoint, you know, I used to always think of myself as, you know, okay, maybe I could mentor as a leader to the extent people want me to, but also now I think I'm going to start to incorporate parenting as having been a working mom for years. Like I think I found this year that I could offer some help to folks who were struggling with younger kids at home. And I had always separated the two. And I think we have to integrate the two and help others with that, kind of what we've learned, lessons learned. It's professional and personal has definitely gotten a little bit more mixed.
It's one of those things I like it used to be that women, it was like mortifying if your kid interrupted anything, right? But like for us, whenever a male partner would bring their kids into the office, he was like the father of the year, how cute, like we all had to fawn over the kids. They would make us, you know, pictures and we'd pretend like we weren't busy. But like let a woman do it back in the day. And it was like, she does not have her stuff together. Like, I think that that's changed now, hopefully. And I think that we don't go back and we embrace sort of the holistic person, right? So if you're a mother, you don't need to hide it. Like you don't need to compartmentalize to the level of making it another stress factor for you. We don't care anymore. We've already seen the inside of your house like for a year. The question is, you know, what will it look like moving forward?
So I love how you say that, because actually one of my favorite things about working remotely and being on Zoom is getting that sort of more personal connection with some people, like their dog sitting on their lap during a Zoom call, or they're holding their baby, or, you know, you can hear screaming in the background. And it's definitely kind of, you know, created more of a personal connection in a lot of ways, which is strange to say because you're over Zoom, but you have a little bit more insight into the lives of your, you know, your team members and your colleagues. So that's something I think that I've enjoyed through all this. I would say that we're still at BJ's trying to figure out what that's going to look like for the future. And one of the things that we've learned, you talked about continual assessment. I talk a lot about continuous learning. You know, so we have to assess, but we also have to learn from those assessments. And I think that we've learned an important lesson that we can't assume what we think our team members are going through or how they're going to feel about something. We have to ask. We have to actively listen. We have to ask. And that's why those surveys have been really important to us as an organization, because it's giving us that information from our team member base about what are the struggles that they're dealing with, what are their fears, what are the things that they loved about working remotely, and how can, what can we do with that information moving forward. I think that what we'll see is we will return to the workplace, but it will be in a much different way probably than what we had prior to 2019. So while our hope is to get as many people back to the office as we can, that will offer some flexibility as well, right? So it's not going to mean that everyone has to be there 5 days a week. So what does that mean going forward? We're having a lot of really great conversations about that. Because I think, Desiree, you may have raised it, or AiVi, you may have raised it, that how do you create that equitable workplace where if someone is in a meeting by Zoom, how do they feel really truly part of that meeting if other people are in a room at home office, right, so that they're not missing out on those conversations that may come before the meeting and after the meeting, but they're really truly part of that conversation. So I think it's raised a lot of great conversations, deeper conversations than maybe we have been having, but we are having now, which I think is only going to benefit us for the long run.
I have a couple of points about this continued assessment. As everyone's been saying, this is something that employers are likely going to need to do continually moving forward. This is hopefully going to be, part of just how we operate as employers. And a couple of things to keep in mind. I think it's important that when if you're changing your leave policies or your benefits, or even if you're granting accommodations, whether they're for a protected reason or not, you're always, maintaining the expectation and the disclaimer really that the employer can modify this, and we might change this. This isn't forever. This is a good practice generally, but especially when these benefit leave policies or accommodations are short-term to address the impacts of the coronavirus. We don't want any employees thinking that I've been promised this for the full time of my employment or for any set period of time. We want to make sure that we're always including that disclaimer about this being discretionary and the ability to modify. In addition, I think when you're having these individual conversations, it's important to document the accommodations that are being made, especially if they are for a protected reason. So for example, if you're granting an accommodation related somehow to remote work, you want to make sure you have that documented, because if you do transition back to the workplace, you might need to follow up with those employees who have that accommodation to see, okay, you had this accommodation through remote work, how are we now going to accommodate you in the workforce? So I think those are a couple things to keep in mind when you're doing this continual assessment.
There was a question in the audience, and I'm just going to paraphrase a little. So were there situations where a single mother just literally could not come into work, and they could not afford the childcare, they could not get childcare, and they couldn't get to work at all? What if there were those situations for you? How did the company manage that, or how did the company work with that specific employee?
So we certainly had those situations and accommodated. We were flexible. So either what we did was we, again, furloughed them, put them onto that voluntary time off where it was unpaid, and they were able to collect unemployment. There were a lot of things that went on in each of our buildings. We have 23 buildings across the network where people were just helping each other out too. They were swapping schedules. They were saying, hey, if it was a last minute call out, people were jumping in to stay overtime, right? So a lot of it was grassroots, but what was one of the things that just made me so proud to work for Staples was how amazingly supportive everybody was of each other. So we found a way to make it work.
Yeah, I would say, as I was thinking, because I was, there were plenty of situations where, it ultimately resulted, right, and the colleague couldn't, either come to work for a particular period of time, and, whether it was childcare obligations or, caring for someone who was sick, the surge affected everyone, not just employees, family members, the whole 9 yards. So, I think kind of just piggybacking off of Katie, mentioned it, at that point, it's kind of what do we have here to best suit this person's needs, whether it is, where, it's best suited to take a leave with the option of filing for unemployment, which was expanded during this time for that very reason, you know, or was it, you know, looking at our personal leave policy, which we did, you know, end up extending, you know, providing an additional, you know, 30 days onto that during this time period, again, for these types of reasons. And I think, again, it's that's where the communication with the colleague, you know, really comes into play, and finding out what they need, right? Because it's, you know, and what I hear in that example, right, is unpaid leave is probably not going to be the answer that they need. It's going to need, I need time off, but I need some kind of compensation. And so I think at that point, you just go through all of the different resources, whether that's collective bargaining agreements or policy, to kind of see what you could do for that colleague.
I think another important thing to remember is that the FFCRA, which was required, no longer required. However, the tax credit potential for a tax credit has been extended through September 30th of this year. So employers should consider, because as you might remember, the FFCRA does allow, you know, for among other types of leave, leave for a child whose school or place of care is closed due to COVID-19. So employers should consider whether they do want to offer this. And if they do, you know, they could potentially get a tax reimbursement for that. It's a limited period of time, but it is something to consider because that's good through September 30th of this year.
Chelsea, thank you for that little tidbit. One thing too about looking to the future, which I feel like this past year, mental health awareness has been embraced in a way that it should have been embraced for so long. And I think that there is going to be some mental health impact that hasn't happened yet because people are still in survival mode. But I think you'll see that your employees, that year of reset that Katie was talking about, how are we thinking about, you know, people who will need time to grieve because they couldn't grieve this past year, people who are just burnt out but can't articulate why they're burnt out. You know, how are your companies thinking about it, and how are you or are you implementing things that will encourage employees to take care of themselves, sort of their mental health?
Yeah, I would say that we really focused in on our employee assistance program over the last year to make sure that all of our team members understood that they were eligible. You didn't have to be on health insurance benefits, that it was available to all of them and their families, but also to kind of educate team members about what it offered. So it was mental health counseling, it was access to, you know, information about childcare and different things, because I think that a lot of people in our organization may have thought EAP was only available if there was a grief situation or something like that. And so we really wanted to expand that. We also made a decision that if people have to grieve, or if there are going to be services for the loss of loved ones going forward, that our bereavement leave would be extended during that time. So there wasn't a time frame under which they should take that bereavement leave, but that we would extend it to the time when it worked for that team member. We also introduced Headspace to all of our team members in order to provide an additional resource, and really just to educate our teams and our managers about, you know, mental health awareness and how they can talk to team members about those concerns. And I think we've always kind of, you know, shied away from that, or having our managers shy away from those conversations in the past and maybe focus only on HR having those conversations. But it was really about educating them and making sure that they could have those discussions in the moment.
Yeah, to your point, Shelley, we similarly used our leadership teams to go out and do sort of a one-pager commercial about the mental health services we were offering. You know, I think it's become more and more acceptable to talk about it, which is great. And for us, this pandemic just pushed it even more to the forefront. So we already had programs, but to your point, people were not necessarily taking advantage or had limited understanding of them. We also included things like financial wellness and even like college planning, which might seem odd to do that in the middle of a pandemic, but the reality was that there were people that had to try to plan for this and may have been facing some sort of financial hardship because maybe a spouse had been laid off, et cetera. So we looked for other ways to ease that stress that they might be having. And finally, we actually are sort of reinvigorating our business resource group, which is a parenting plus group. And we'll end up having kind of, folks that come together and share, situations, problems, challenges, et cetera. But I couldn't agree more. The mental health piece was huge, and just kind of getting that word out. Every opportunity you have to talk about it, we throw it out there. So.
Right. Well, and you have to, because it is. I think you have to, right? Because I think AiVi, your point that mental health is being talked about for the first time in a major way. I think also it's kind of recognizing what those triggers are. I think, and how you're impacted by your emotional mental state is kind of sometimes hard. Especially, I can speak wholeheartedly as a woman. Like we're taught to just go, right? And like you just keep moving, and you don't really have time to stop and take that breath. And I think part of it is giving people that space to kind of do that check-in and see where they're at. Something that UMass did through our Caring for Their Caregiver support initiative, which was something we really vamped up during the pandemic, was to kind of create, different modules, around stress management and what that looks like. Because I think there was an assumption, right, that people hear the word mental health and they think, oh, well, I'm not depressed, I'm not crying myself to sleep, that doesn't fit me. But also kind of knowing that stress is a lot of different things and manifests in a lot of different ways, and educating and getting the word about that as well, in addition to kind of what the resources are, I think is, parcel of what we're all doing.
If I could add to this, it's every organization, Katie, when you were talking about promotions before, right? Like, okay, I set goals for myself at the beginning of 2020. Maybe I didn't hit those goals, and maybe my managers should not hold me to those goals. Like, these are the little lists that are obvious, but I don't think they're obvious to a lot of people, where it's give people a break. They didn't hit their numbers, give them a break and just give them some grace. I want to take a couple questions. One was paid time off. So someone asked, no one's going on vacation. So a lot of people are like, I'm going to go ahead and save my time. How are you addressing that? And how are you encouraging people, if you are encouraging people to take that time so that it's not, 2022 and everybody's just in Aruba?
No, we've definitely been encouraging, folks to take their paid time off. I think, at different points in time during this pandemic, we saw a lot of people, especially in the beginning, with canceled vacations and things like that. So I think the first strategy was to be flexible around that and not, necessarily force people to take vacations that they weren't going to be able to take, and hold that time if they needed it for, some other later in time, for their own, needs, or for the needs of someone else. I think the other thing that we did that was key to this is that we did extend our PTO accrual limits out until December 2021. So people who are, set at the certain limit wouldn't lose their time if they hadn't taken it. You were allowed to accrue up to an additional budgeted week of hours, and hold on to that for a little bit of extra time, so that as we kind of move forward and Aruba opens up, folks can, use their time accordingly.
And that's with the understanding that management is going to have to do some shuffling when these people are taking their time. Like it's like reflecting, saying, we are willing to take the hit because our team took the hit for a year, Anybody else with creative?
Yeah, I would just, for our hourly folks, we offered PTO buyback in some of the groups, so that if they didn't have time, we were not able to extend our year-end cap in terms of when people had to use it by. But I think they just liked having that option, and a lot of them used it. So
a quick additional thing. So when we draft our leave policies for our employers, I always put something in there about the employer's ability, to schedule consistent with business necessity. So it does give you some flexibility, because that was one of the concerns that, everyone's going to take it at the same time. So I would encourage you to build that flexibility into your leave policies.
Good point. Yep. And one last thing that I think it needs to be said, and it was a question too, was, aren't you scared that people are going to take advantage of the flexibility that you're putting in place? Are you nervous? Like, well, how are we managing the shirkers?
Well, I think, it might have come up in our prep conversation, and I think maybe Katie, you're the one who said it, it's gonna happen whether you have
say it
here. Or not. There's always room for gamemanship with any policy, procedure, practice, and you would address it. I can say this for UMass, we address it the same way we would with any other, standard. It is part and parcel of having a workforce.
Yeah.
Yeah,
And I would say that over the past year, folks should be able to figure out more who can and who can't manage through it. So,
and I would end that by saying I think that's generally the exception, right? So not to base your policies or your programs or how you're going to treat your team members based on those exceptions, but to base them on the fact that you think people are going to show up for work and want to do the right thing every day, and then address the outliers accordingly.
I think that's a good place to sort of end, where it's maybe in the past, policies have been written to ensure that employees wouldn't take advantage of the system. And that is sort of by definition a little bit distrustful. And I think the pandemic has taught us that you can trust your employees. Everybody's doing the best they can, and your businesses survive, and we're operational. And some businesses thrive during it. So moving forward, looking to the future, the empathy piece and the flexibility piece it's a business decision too. It's not just us being nice to be nice. This is what's going to make your business thrive. And with respect to women, we've seen that this flexibility is what women have needed all along. And now we can recognize it and implement it. And it actually is probably good for all employees, gender blind. So with that, thank you. Oh, look at 101. What a good moderator of time. I'd like to turn it back over to Chris just for the housekeeping stuff. Are you there, Chris? Oh, and also, I'm sorry if we didn't get to your questions, but Chelsea and I are open, we'll follow up with those who have questions that I can identify who you are that asked the question. And if not, please feel free to email Chelsea or me, and we can certainly get back to you, and we can touch base with the panelists if there were specific questions for them.
Well, thank you, AiVi, and wow, what a terrific discussion. We covered a lot of ground and probably could keep going for another hour if time allowed, but thank you so much. Thank you again, AiVi, Shelley, Desiree, Katie, and Chelsea, for really being a part of this discussion. It was really important and informative. Thank you once again to our sponsor, Bowditch and Dewey. And as we mentioned before, we are taping this, and the link will be sent out later this afternoon to everyone who pre-registered. And again, like AiVi said, we'll get to any questions that we couldn't get during this session. So thank you all so much. I hope everyone has a great afternoon and gets to enjoy this beautiful day.
thank you.